In this video, I'm gonna go over the lateral step up and over. The purpose of this exercise is to train hip and knee strength and stability as we move in the frontal plane. The target of this exercise are the glutes, then the quads, as well as partially our ankle extensors, specifically as they work in the frontal plane. We're also targeting the glute medius because we are actually working on either working in that plane or stabilizing in that plane. It's very similar to the forward step up, and it just targets the exercise just a little differently than facing forward. One video to check out is the lateral step up, as I go into a little bit more detail there and a little bit different detail than I do in this video, though it isn't a prerequisite to be able to do that. It kind of is a prerequisite. It just is, I talk about different things in that video. What you need is a step. Anywhere from 8 inches to 20 inches is pretty good. If you're fresh off an injury, then you want to go lower. Anywhere from 2 inches to 4 inches to 6 inches is a starting point. And where are you going to begin? Is you're standing on the side of a step. One leg steps onto your step, then you stand all the way up on the step, and then you step down on the other side, and then you repeat. From the side, full foot on the step up, then step over. Now, things to look at, things to keep in mind when you're stepping up. Variation 1, and this is where my individual programming comes into place. Hips sit back and down, shin is pretty vertical with the floor for a hip dominant strategy. Otherwise, you're gonna be a little bit more upright. Knee is going to be forward just a little bit. But either way, knees aligned with the middle of your foot. You drive through your heel and the ball of your foot, squeezing your glutes as you stand. Then you sit your hips back and down, knee comes forward slightly as you reach your opposite foot down to the ground, and then replace. I may say just do it like this as an easier option because there's less weight transfer. I will link the video in the description on weight transfer because here's what that is. What makes these exercises harder for motor control is you go from a period of 2 legs to 1. So you pass on your weight and you basically ease off the muscles on one side like a dimmer versus a light switch. Then you take the weight and you're dimming up how much you're engaging through your hip. You're growing through your leg as you squeeze your glute, reaching through your body as if your head was going to touch the ceiling so that you're recruiting through the hip, through the quads, and through your ankles. And then there's another weight transfer. So then you shift your weight over to the other side to unweight this leg so it can drop down to the floor. Hips stay level, and then you come down. Last thing is a variation to this. If we want to target more of the side glutes, I may want you to allow your hip on the step to pop out a little bit so that you're stretching the side glutes. Then you're going to squeeze through the glutes as you pull through on the other side, and then you're going to drop and reach that leg down, the bottom leg down, and the standing leg out to the side to stretch the other side, and then you transfer weight, tightening on the bottom leg, and then coming down with the other leg. And it looks like this. So it's kind of like a skater. I'm going to show you from the side. See how far forward I am? That's going to be a little targeting the glutes more. If I'm upright, it's going to hit my quads more. So I like this way more for me and for most of my patients based on who I'm working with. And it's kind of like a skater action. And you can even see my arms moving a little bit more. I'm inhaling as I load. Exhale here, inhale here. Inhale, exhale, inhale. Now exhale up, inhale down, exhale down. Or slowing your breath and not worrying about it so much and really focusing on the legs until you got it down, then playing around with breath. Where you're gonna feel this is your glutes, your quads mainly. If you have any questions about anything I covered in this video, please comment below or reach out directly. Otherwise, thank you for watching, and I'll see you on the next video.